Hello everyone, I am Dr. Minal Mohit, Consultant and Head, Department of Endocrinology, Manipal Hospital, Jaipur. On the occasion of World Obesity Day, I take the privilege of talking to you about what is obesity. We define obesity as the accumulation of excess adipose tissue in our body. How do we measure obesity? We have various parameters, and the most commonly used is BMI, that is body mass index. Body mass index measures your weight in kilogram in respect to your height, that is kilograms per meter square. If you are more than 23 kg per meter square, you are considered overweight. If you happen to be more than 25 kg per meter square, you are considered obese. Now, as per the latest definition, if you are obese with any of the complications or comorbidities limiting your physical activity, then you have stage 2 obesity. But if you are only obese but no other comorbidity and no limiting physical activity, then you have stage 1 obesity. Is BMI the right parameter? No, definitely not, because a man can be muscular, but that is not a disease. So, we use other parameters like your waist-hip ratio, where your waist should be less than 90 centimeters if you are a man, and it should be less than 80 centimeters if you are a woman. Other parameters measure your waist in respect to your height. So your waist height ratio should be less than 0.5. So these are the various parameters. Besides that, you can also measure your visceral adiposity. If you have more than 25% of the visceral adipose tissue, then you are overweight. If you have more than 38% of the visceral obesity as a woman, then you are considered overweight or obese. Is there a rising trend of obesity in the recent era? Definitely yes. So what are the factors contributing to the rising pattern of obesity? First of all, it is our changing lifestyle, our changing eating patterns, our decreasing physical activity, increasing sedentary life, increasing screen time, our devices, our gadgets. Now, why are we concerned about obesity? Obesity in itself may not be so far considered a disease and may be taken as a cosmetic problem, but in actuality, it contributes to the increasing incidence and prevalence of type 2 diabetes, pre-diabetes, increasing incidence of cardiac events, cerebrovascular events, increasing incidence and prevalence of osteoarthritis, depression, psychosomatic behavior disorders. So obesity contributes to significant morbidity. So can we do something to prevent it? The behavioral change has to begin right from the childhood, or rather right from the fetal stage. Behavioral pattern has to change for the entire family. So besides the lifestyle changes, we now have some molecules also in pipeline which have been approved by FDA for the treatment of obesity. Most commonly used at present is GLP-1RA. We have injectable GLP-1RAs as well as oral GLP-1RAs. They have been approved for the management of obesity. Moving beyond molecules, we have seen significant good results with bariatric surgery also. So that is employed only in cases of morbid obesity, but definitely yes, it plays a big role in preventing morbid complications. So 4th of March every year is observed as World Obesity Day, and it is significantly important and required to bring about awareness in the masses. Education is important. At least one day we should draw our attention as a whole, as a combined effort we should upfront that yes, obesity is a disease, or at least the root cause of major metabolic diseases, and it is high time that we all unite together to prevent obesity, to prevent metabolic complications arising out of obesity. Thank you.